So now we're going to shift gears a little bit. So Iain is going to stay here. Please, Iain, you can sit here. And I'm going to invite our two guests to the stage. So first of all, Nathalie Moll, who is the new Director General of EFPIA, the European Federation of Pharmaceutical Industries and Associations. And Nathalie has previously worked as Secretary General for Europa Bio and is very welcome to IMI, to the IMI Governing Board. Very happy to have you here, Nathalie. Thank you. And Kurt Vandenberghe, who's the Director for Policy Development and Coordination, DG Research and Innovation of the European Commission. And Kurt, thank you very much. And we know you're very busy developing FP9. So Kurt is taking a major role in developing the FP9 framework. And so we're very lucky to be able to have him here today with us. Thank you. So I'm going to kick it off by asking Iain to remain silent for a few minutes, which I know is a challenge for him, but I'm a lot of trust. And asking Nathalie, firstly, and then Kurt, Nathalie, where do you see this is going to be a futuristic, this is a going forward conversation. And where do you see, from an FPIA standpoint, some of the things that Iain was addressing in terms of, how open is FPIA going to be in terms of bringing in new stakeholders? How do you see the implementation of the convergence of technologies that we're seeing? How do you see that? Because it's a moving ecosystem. Each part of the ecosystem is moving. So tell us your few thoughts on that.
Thank you so much, Pierre, and good afternoon. Thank you also for the invitation. It's really a pleasure to be here. A little bit difficult to speak after Iain, and even harder to speak after Iain and Pierre. I've done this before in the bioeconomy field. So, but what is really good is that there are opportunities to pick up on the excellent concepts that have been already explained here today. And I think my two favorite ones is. We can't do this alone. And the other one is investing in science matters. So as a scientist, as a biotechnologist, I could spend hours and hours reading about every single project of IMI, and then I think my board would get a bit upset that I'm not doing anything else. But for me, it's a super exciting, incredible invention, really. And I remember in 2005 when we started to discuss it, and as I was from another association, I only came in and out occasionally, I could see the potential, and I participated in the creation of a similar PPP, although slightly different in the bioeconomy space, because we couldn't do it alone. And it was clear, and the sector at that time, the biotech sector, had this fantastic technology, but we didn't have money to create biorefineries, and we didn't have the material to put in those biorefineries, and we didn't have the industries that would use it, so we had to do things together. And I really see IMI. At the time, I remember inviting Magda to a meeting in the commission to tell us, how do you make a PPP? How could we make it work for us? Imagine. And, so the good thing is not only can we not do it alone, but we also learn from one another. So that's rather reassuring. When you said, how is FPIA, is it open to other sectors? Well, I was at a meeting last week with Magda of the, I'm laughing because it was just so eye-opening for me, of the Association of Research Centers, and we were listening to your colleague telling us about FP9, possibly, and I saw Magda speaking to the head of the Textile Association. I said, Magda, what are you doing? Yeah, but the Textile Association, yes, IMI, right? Sensors, collecting data on how people feel, clever, intelligent materials. Okay, and later on there she was talking to the head of the Automotive Association. I said, yeah, come on, Magda, cars, really? Yes, of course, because they have sensors on the windscreens that understand how the people driving feel, and if they're getting a bit drowsy, if there's a problem, and we could use that in our... Okay, so the question is, are we open to other industries? I would say yes, definitely. We can look back, or we can look forward, as you said, and I think IMI 1 was the first of its kind. it took a lot of courage, I think, for an industry to say, okay, we can't do it alone. An industry that is used to doing everything alone, from growing a tiny idea into an end product and the 10,000 to 1 probability of success there, to recognizing the value of sharing its information and accessing other information and focusing on areas that not necessarily are the ones that the industry would have focused on initially, but really accepting input elsewhere. So I think the proof of concept is done. Yeah, IMI 1, we're in IMI 1, 59 projects, you said, IMI 2, already too many. But the proof of concept that everybody wants to work together and everybody can work together is done. I remember the beginning, the IP questions, the SMEs, Europa Bio represented lots of SMEs. I remember everybody sitting down. I remember sitting down with you, Michel, and saying, okay, how do we fix this? How do we make SMEs feel more comfortable about sharing? How do we still keep intellectual property in so that it's still interesting? Because if you take it all out, this is an industrial development that doesn't make necessary sense. So how do we... So I think it's an evolution, a healthy evolution of a whole sector, because I think I would include researchers in the sector. I wouldn't just say industry as a sector, involving the patients and facing the biggest challenges we have, which are health challenges. I mean, these are the biggest challenges. We cannot afford everybody to sit in their little corner and say, well, I don't, I can't possibly, I'm sure I'm going to get there on my own. I don't think I think the concept has evolved since then, and we would really like to work with others and to I don't know what IMI 3, if it's called IMI 3, looks. I really hope that FP9 continues to have a strong focus on health, because it's not going away. We have lots of other threats, and I've seen the difference in the way governments invest. Security, migration is taking up a lot of investment. It is. But health issues are still there. They're there for everybody, and we cannot afford to let those slip off the radar. And so I'm very hopeful that we can evolve in an intelligent fashion in order to continue to respond to the needs that we have at a European level and then with a global impact.
Thanks a lot, Nathalie. Kurt, you have quite a broad background in research policy in terms of climate, transport, and so on. So you probably can see things from an even higher level. Where do you see the trends from a European Commission side? Where do you see the trends in these, in the innovation practice, open innovation, public-private partnerships from that angle?
Well, first of all, like Nathalie, thank you very much for having me on this panel. I found Ian's presentation very instructive and excellent. Thank you very much. I think you've said it all, as far as I'm concerned. And if ever Brexit would happen, which we wish it wouldn't, I'll ask my superiors in the Commission if we can give you asylum in Europe. We are at a quite challenging moment in time, I think, because there are plenty of discussions on the future of Europe, coupled with discussions on the next multi-annual financial framework. It doesn't happen so often that strategy for the next decade comes together with budget discussions, which in a way is a challenge for us, but also an opportunity, because as Ian was saying, if we want growth in the future, if we want prosperity, then research, innovation, and I would like to add education, are probably the biggest levers we have from public policy point of view to get that kind of growth in the future. And I think the question for us is not, do we want economic growth or prosperity in the future? The question is, what kind of growth? And that growth must be decarbonizing, dematerializing, very much digitally driven, much more democratic than it is today, decentralized, etc. So that means we need to invest more in research and innovation, not just at European level, also at the member state level. And it so is that we actually have a fantastic asset in Europe now with Horizon 2020, with the framework program. We've gone through the interim evaluation, including for partnerships like IMI, and I think we are justified in saying that Horizon 2020 works. it's a success. IMI is part of this, and I really would like to thank everyone involved in IMI of making this a reality. The Commission is a very proud partner of this venture, and it's important because IMI is not only showing how important research and innovation is for the future, but that you can also experiment, that you can evolve. That will be very important, so that IMI is not seen as a static, but really at the forefront of innovation. And there Iain has given a few very good insights on how to do that, I think. But it's also related to health. And I think if research and innovation education are the fundamental levers for our prosperous future, health is also the issue that matters a lot to citizens. So Europe should deliver there as well. So Horizon 2020, including the PPPs, are a big success. That matters because we need to invest more in it. But we also see a few areas where we can do more and better. And that is overall for the framework program, but including also for the IMI type of partnerships. One is the relevance. These investments we make for the program overall, but also for IMI, are very relevant for the immediate stakeholders, the clients, if I may call them, the clients of the research funding. The relevance of this for society is another thing. And I'm saying this because first we cannot maintain the legitimacy of all these investments in the future if the societal relevance is not coming out more clearly. But also because if we want to succeed in science and innovation in the future, we need more innovative societies. That means that we need to involve the end user, the patient, but society at large in all these ventures. And I think, Pierre, looking into your biography, you have some very good experience in this co-design, co-creation space. So I really would hope that IMI in the future can be the pinnacle of really this kind of venture. Secondly, breakthrough innovation. We see that this is missing from the framework program. We are very good at incremental innovation. We don't have breakthrough innovation. Now, incremental innovation remains very fundamental. Don't quote me as saying that incremental innovation is not necessary or good. It is. And we won't have breakthroughs without incremental. But if we don't have any breakthroughs, any market-creating innovations, including through PPPs like IMI, then we may ask the question, what are we doing wrong? Because it happens elsewhere in the world. Thirdly, impact. You said it, Iain. Impact is very important. And I very much agree with the question on the time frame. We have to have the right time frame in mind. But we really need to look at what kind of impact do we want and what kind of impact can we promise for the taxpayers. That's why we go in the concept of missions in the future. And I would hope that IMI can also help us in designing and implementing, delivering on missions, where we evolve the framework program not from evolve it from a funding program to an investment program, and where we move from subsidizing sectors to investing in systems transformation, because that's the key for the future, and openness plays an integral role in this. And last point I would like to say is that what we need to do much better in FP9 is what I would call the instrumentology. The landscape has become very complex. We've done a good job in simplifying rules and procedures, but everyone is bewildered by the inflation of instruments and acronyms, etc. So we really need to put purpose and impact above instruments, clients, and I would add policy DGs in the Commission as well. And also there I hope that IMI can help us set the agenda rather than defend the sectoral approach as such.
Thank you very much for those insights. I'm going to ask Iain maybe to, if you have some comments to react on what you've heard.
Well, I think we're at risk of violent agreement up here on the stage, which is Well, I think that's almost revolutionary in this kind of conversation, and it gives me incredible hope. I think I would pick on three things. First of all, going back to this idea of the 3 O's, open to the world. I think we clearly have to be open to the world. That's where markets are evolving. That's where we have a social and global responsibility. It's also where there are some fantastic ideas and competitor ideas coming out. And being a little bit more obviously open to the world and how, Kurt, you address some of these issues that you've talked about in more of a partnership where that makes sense. I'd really like to see that develop more. You used the term instrumentology. And I think you're right. I think around opening to the world, I don't just mean within Europe or within EU framework programs, we do tend to get focused on instruments rather than actually what's the purpose. So the open to the world is one key one. I think the second is that social impact and understanding that social impact, involving end users. It's about health. But you're right, it is about more than health. It is about our nature of ourselves as Europeans, as a society, and seeing that more clearly integrated into what we're trying to achieve with funding is really key for me. And the third is risk, and it picks up again on your incremental versus disruptive space. But I think we do have to take some risks. And I'm not talking about doing crazy things, but I'm just, let's be more tolerant of failure on some bigger things so that we can experiment and can deliver, somebody asked the question, the creative conditions for that disruptive innovation. And I think if we are too focused on that instrumentality and that creativity will be a challenge. But from the sounds of things, all I'm doing is I'm making comments that are falling on very receptive ears, both from the Commission and from EFPIA, which is extremely rewarding.
Do you want to say something, Nathalie?
Could I add something here?
Sure.
I just wanted to add, because I think we're talking a lot about the research side and about what IMI delivers, etc. But when I saw your graphs up there, Iain, and I saw China, not that I have a problem with China creeping up, but it's certainly creeping up. I think in the EU, we have a tradition of being exceptionally good at funding research. We're really good. In one way or another, with an FP program, with whatever it is, we will find the money to help research go forward. And in the past, we had the brains, and then we had also the regulatory systems, and somehow we got products on the market. Not as many as we might want to, but we managed. Nowadays, the competition for the research is exploding, but the competition for the incentives to get the products to be developed in other regions is also becoming much, much stronger. So I always think of a slide when you go from a slide, as in a slide that children go on, when you go from research and development all the way to market access, and you have the approval, the assessment approval, etc., and market access. And I think in Europe, if we're not careful about keeping our slide extremely squeaky clean and slippery, we'll do the research, and then it will go elsewhere. And we will not get that prosperity that you were mentioning before, because it is essential to fund research. In order, investing in science matters, but not if you're not the best in class in everything else, so that the companies who develop the research then get the stuff to the market afterwards. So I just wanted, because it was a missing point, and I know it's not something that IMI can address, but it is a policy issue that is extremely important. And as other regions become smarter and more organized and have incredible incentives, but also very fast regulatory systems, we're in a race.
I mean, you say that it's not something that IMI addresses, but we keep on saying, well, we're into end-to-end integration, and we're looking at all the different paths. So we should be looking at that, and this is why in our project, we're trying to build in the regulatory voice, the HTA bodies, the so on and so forth. Now, maybe we don't do that as well as we could do, and maybe we need more of that thinking and then more of the social piece as well, for sure. Yes, Kurt.
No, what Nathalie is saying is very important. It's also coming out of the Lamy report, written for us to give the orientations for the next framework program. What we have in Europe are two acute paradoxes. One is the innovation paradox, which is what you say, Nathalie. We are traditionally very good at science, or rather good. We have to keep that quality. But we're notoriously bad since a long time of translating that science into value for economy and society. And the other paradox is something where the whole world is suffering, but especially Europe, it's the productivity paradox. We see a lot of new technologies, new knowledge coming, but this is not, again, translated into new solutions for economy and society. Except for a few, the leading innovators, the GAFA economy, Google, Apple, etc., who really reap all the benefits, and that risk leading to a concentration of benefits of this innovation. So Europe has to be in that space, and that's why open innovation is so important, because open innovation is really about involving the end user in creating the new markets of the future. So our policy line is not that we have to invest in research and innovation to address market failures. No, our role is to create the new markets of the future. That means that we have to look indeed at the regulatory side. That's why we're so insisting on the innovation principle, which should be part and parcel of our policy making. We're experimenting, as Iain was saying, with things like innovation deals, where we ask the innovators who are blocked by European law obstacles to come and see us, and we see together how we can overcome these. So we need a systemic approach, which is linking technology innovation with business model innovation, finance innovation, but also regulatory innovation, social innovation. I would like to add skills innovation, very important. We need to experiment and then scale up the solutions that work, that we see working. That is the future. And I see a role for IMI in working in that space as well, definitely.
Thank you. I'm going to open it out now to the audience. If there are comments or questions. Yes, we have one here. Eric, you have a microphone here. I don't know if we do have questions.
Thank you. Erik Tambuizer from Biopontis Alliance. A bit related to the previous discussion, I wanted to come back to one of Ian's points, which is the few associate partners that are involved. Is that perhaps, and that's something to bring up to the panel, related to the fact that projects have to be started or initiated by industry? Are we missing an opportunity to be more innovative in another way, in that way?
So, Magda, did you want to answer that question? I saw your hand going up very quickly, so...
But it wasn't to respond to that question, Magda was from EFPIA. I can respond to that question, though, but I would like to ask another question later. So I think that the important point to understand is that the ideas that are being developed in IMI are not uniquely coming from industry. And I don't think that this is really well understood. Anybody can come with an idea, post it on the IMI website, talk to the IMI staff, and these ideas were an investment from industry is possible, because please remember, there is no IMI project if there is no first an investment from industry. So where an investment is possible, that's maybe the limitation of IMI today, then these projects are taken up. So this innovation comes as well from outside as it comes from inside. So I would like to clarify that. But can we do better? Yes, definitely we can do better.
You had a question?
I have a question, yes, a question to Kurt actually. I very much like hearing what you say about agility, flexibility, etc. We are now in a stage of developing new ideas for the second term of IMI2. And without talking about the far future of Framework Programme 9, we try to actually come with things that we haven't done before and to do innovative ideas, testing, new business models, etc. And actually, every time we try that, we sort of hit the wall of the Horizon 2020 regulations. Any chance of being able to test those new ideas in IMI2 without waiting for a hypothetical IMI3 or a Framework Programme 9?
Kurt, before you answer that, what I'm going to do, because there are quite a few hands going up, I'm going to take questions. So I'm noting down Kurt, flexibility, right? And this gentleman here.
Hi.
Yes, please.
Can I ask?
Yes.
Hi, I'm Patrick Meulien. I work for the Scientific Institute of Public Health in Brussels. I don't have per se a question, it's more a comment, in the sense that there are a lot of IMI projects that are ended or close to end. And it's also the same for the same situation for some biotech company, in the sense that once we reach the end of a project, we have a lot of difficulties to move from the end of the project to make something real concrete. And as experience as a vice president of a small biotech company in the past, we experiment exactly the same difficulty. It's been that once you reach the project, to go to a more industrialized steps, it's very complicated. The European Commission doesn't really help in that one, because they make very complicated, very heavy, very sophisticated way to get some finance and to get some support for developing the project. And I think it's a real pity, because some of the projects are just lost because we don't have the right instrument to move from the first steps of development to a real concrete product at the end.
So you're saying there are gaps in the ecosystem?
Absolutely.
Funding gaps in the ecosystem?
Or things that are very complicated, heavy to handle, that it's not very easy to go for.
Okay. There was a comment question here.
Yeah, thank you, Pierre. Maybe a comment and a question. My name is Martina Glieber. I represent Pierre and I wanted to say that indeed the diagnostic industry is very happy to be now also involved to IMI, and we think that especially early and smart diagnostic is an important mission for efficient patient treatment also in the domain of infectious diseases, IMR, but also other diseases like cancer, like Alzheimer, or cardiovascular diseases. My question would be to Kurt also. Of course, the diagnostic industry would like to see a sufficient budget for health in the new framework program. But I think we mentioned also before security and migration. And do you think that health has also a place, especially I think about global health security, important question. I think about MDR tuberculosis in the domain of migration. So do you think that health has also a place in these topics, security and migration? Thank you.
Thank you, Martina. We're going to take one more, and then we're going to go back to the panel. There was one more question. Was it Nico? Oh, sorry, Elisabetta. Sorry. Ladies first.
I will be fast. First of all, so I'm Elisabetta Vaudano at the IMI office, so dealing with project with the partnership every single day, more or less, also weekends sometimes. But anyhow, thanks very much, Iain, very inspiring. I have a question that actually comes when we discuss with the project. We're talking about open innovation, and then sometimes we talk with the project, but where are the incentives to get to open innovation? We need incentive, and we don't have, especially when we talk about research or university. So that's a question that I get, and sometimes discussion that we have. And also another one, also when we talk about impact, that for academic impact should maybe change. But again, where are the incentives there? If we don't have incentives, nothing would change.
So I think we're going to go back to the panel with flexibility, with a health budget in the next framework program, and with incentives, because if academics are only get career development because they publish in Nature every what's the incentive to do other things with other people? So maybe Kurt, would you like to start?
I'll take flexibility first. That's not the easiest for us, as you can imagine. I think we have gotten a lot of appreciation for the progress we've made in simplifying rules and procedures in Horizon 2020. The public stakeholder consultation has told us that 75% of stakeholders don't see or don't know of a program that is simpler than Horizon 2020. And one of the big progresses made in simplification is that we have harmonized the rules across the whole framework program. In the past, we used to have framework programs with 18 different sub-programs, and every sub-program had its own rules, its own approaches, etc. We have harmonized this, and the end result is that for the beneficiary, it has become much more simpler and accessible than before. But the downside of this is that indeed it takes away some of the flexibility that we would like to see, especially if we want to encourage experimentation. I must say I'm not too hopeful that we can address this in the remaining years of Horizon 2020 because we're bound by a financial regulation, you know the whole story. We have to look in the next generation programs how we can do this better so that we give then experimentation space to all the kinds of partnerships that we want in the future. So that point is very well taken, but I'm afraid I don't have a satisfactory answer for you right away. There was also a question, Pierre, if I may, on the uptake of results, deployment. A very good point. There we need to work as well. We have already started working on this through the Juncker Fund, the European Strategic Fund for Investment, which is helping to deploy through loans and equity investments, results coming out of the framework program. We need to do more of that. That's also one of the reasons why Commissioner Moedas is so keen to have a European Innovation Council, so that at the European level we can start investing in innovative business ideas, very risky, but ideas that have a scale-up potential. Because one of the systemic failures we have in Europe is not that we lack startups. We have as many startups and good ideas as in the United States. The problem is these startups, these good ideas, these innovators or entrepreneurs, when they want to grow beyond national borders, there is no access to capital for this because no one wants to take the risk. So either these companies stay small or they move to the United States or elsewhere. 1/3 of entrepreneurs in Silicon Valley are from European origin. So this is a systemic failure, which we have to address through the single market, framework conditions, regulation, etc. But we believe we also need to start investing so that we create rather quickly these European champions. And that is in a public European interest. That's what the European Innovation Council is about. But also we're working very hard with our colleagues in the regional policy department to see how more of the regional funds can help support the deployment of new technologies, new solutions. Take batteries, for example, in a different area. We are very good in developing the new knowledge for batteries, but all the batteries are produced in Asia. There's no battery production in Europe. If we want a decarbonized, energy-smart economy in the future, batteries will be at the core. So if we can use regional funds to help deploy new knowledge, new solutions developed through the framework program or through other channels in Europe, that would be a big plus. In terms of the held budget for FP9, you will understand that I have no idea how this will look like. This is work in progress. What I would like to say is that I cannot imagine personally that we would have an FP9 without health. At the same time, I should also say that we're looking for ways of how to better embed health in a more systemic approach. We really are looking for interdisciplinary, transdisciplinary even, cross-sectoral approaches. And we're taking the SDGs, the Sustainable Development Goals, as a reference framework, because that should enable us not only to be open to the world, because the SDGs, which by the way have an SDG on health, they're a global contract for the world, for humanity for the next 10 years and more, where science and innovation have to play its role. But also the SDGs translated to European context can help us to move from sectoral approaches to what I said before, Europe investing in systems transition. And what we see is that the nexus between different challenges and different objectives, health, nutrition, Iain was mentioning some of these on his slide, that is where we will see the biggest progress in the future. That is where Europe needs to invest. So health will be there, I don't doubt that. But it will probably be, or maybe be, in a different setting, systemic setting, than we have today.
Thanks, Kurt. Iain, incentives.
So, first of all, let me, very much echo many of Kurt's comments around inter and transdisciplinarity, systemic approaches, looking for, how one addresses the nexus between some of the big challenges. And I think about what you said, Kurt, on investment. I will get to incentives. And what you said on investment is, I see it through the lens of the concept of patient capital. And if we look at capital supply here in Europe, we still have a value of the death on capital, and it is about being patient for that longer term, de-risked with a longer and different expectation on return. And how do we do that? We cannot expect venture capital firms to supply patient capital. We can expect them to buy into patient capital co-funds, but the way we look at picking up on that long-term question of how does 7 years of research turn into products and delivery several years down the line. At the moment, we have very, very, very clunky financial interventions there, and that really is a private-public requirement and duty to do that. And I think we do that poorly currently in Europe. So I welcome that the Commissioner is beginning to think about that. On the incentives question. Academics are some of the brightest people on the planet. That's why they're academics. And they will very, very quickly work out what it is that allows them to indulge in their passion, which is their discipline, their science, or their research area. When I was in the UK Research Councils, we used to talk about excellence with impact. And what we really meant was excellence, 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 and a little bit of impact would be quite nice as well if you could do it, please. Now, with the shift in the way our funding is set up, excellence with impact really means excellence with impact. And we need to be seeing impact and demonstrating that in order to get access to the funds to drive excellence. And academics, very agile about adjusting to that, because what they want to do, I'm one myself, what we want to do is make a difference through our areas of scholarship. So I don't think it's difficult to create incentives, provided there is a willingness to do it, and that might be something that is part of framework. I don't know. In terms of incentives to be involved in open innovation, of course, we get into definitional problems here, because sometimes people talk about open innovation, sometimes they talk about open access, sometimes they talk about open source. And of course, they're all very different things. So open innovation is a collaborative enterprise, but that doesn't mean at all that there can't be assets which people then have the ability to add value to and create value from in the future. So we need to have, it comes back to IP again, I'm afraid. We need to have an IP system and a means of managing our assets so that we continue to have these incentives in, so that when colleagues do exit from these essentially research programs, there is that incentive to then create value and take things to the market.
Thank you. We're kind of running out of time, but are we allowed another 5 minutes or no? You're going to inherit some. Is that okay? Okay, we'll take another. So we'll take one more round, and then we'll address some of these things quickly on the board. So somebody had their. Nicola, do you want to answer the question? And who else wanted to? Somebody over here. Okay. So first one here.
Thank you. Yes, Nicolas Kref from EFPIA. Just one clarification. It was mentioned that there were not enough associated partners. Please do not forget that we also have EFPIA partners in research, and actually Institut Mérieux is one of them. So we have some from the diagnostic sector, from medtech, IT. So do not forget about them. Associated partners are not the only collaboration that there is in IMI too.
Yes, a remark in the sense that the lady made about before the medicines you have the diagnosis. Recently I still read that only 60% of the diagnoses of the medics are correct. That means that 40% of all diagnoses are incorrect, and that incorrect medicines are given to the people. One point, I think IMI should go a little bit in that direction, because that's the beginning. And just to prove it a little bit more, until now, for any examination with a medic, SWAT, a normal doctor or a specialist, no one of them, even at university clinics, ever used a computer to refine the diagnosis about my potential disease. Can you imagine that? Now that our grandchildren are continuously working with their smartphone, a medic doesn't use a computer to make a diagnosis. While using a computer, he could extend his brain by 1 million times, have the latest information about diagnosis, the latest information about medicines, and so on and so forth. I think that should change drastically and immediately. And the second point, on the other hand, on the other side, the patient is not followed up in taking the medicines. There are some little game things. I have friends in Italy who developed some, but there is nothing prescribed so that the patient is obliged to take the medicines as he has to. So these are the beginning and the end of you staying in the middle, where nothing is done so far. Thank you.
Thanks very much for the comments. Very valid comments. We have one here, Vijay. Yeah. Wait for the microphone, Vijay.
We talk about flexibility. I think one of the key things we should not forget is patience. Patience in this is very important. So I think of genomic and metagenomic revolution as great innovations, Kurt. I think they're really spectacular. The problem is when you find that single nucleotide polymorphism or a microbiome signature, to get to drugs in patients takes a lot of time. So I think one of the things we need to do is to sustain these programs, and I think that's critical.
Thanks, Vijay. Now, what we're going to do is we're going to look at some of these questions here, and then we're going to go back to the panel for a last sum up, and then go for coffee, okay? We're going to do that in 3 minutes. So the first one, protecting IP and comply with open access is possible. IMI EC get included in IP coming from grants and make them accessible, plus income gets back to new grants. Okay, I guess that's a comment. Yeah, good. There's one for me. Pierre, what's your rapport d'étonnement after 1 year at the helm? What works and what must be improved? So the first étonnement is that I've been here for 2 years. And it surprises me every day too. I think what must be improved, I think there are a number of things that have already been spoken about in my opening remarks around the evaluation. And I think if we can really open IMI out to embrace this convergence of technology, which is happening, whether it's through the nutrition or the imaging or the high tech or the ICT or whatever, diagnostics, we have to embrace this, because this is where we're going to, I think, add real value and make real benefit and harness synergies where they are. Their opportunities are incredible. So what works? I mean, I think it is an amazing, what has been created, even though it's, the ecosystem may be still at a small scale, it's maybe 10,000 people or 15,000 people. I think that the culture change that has gone on within those individual projects, programs, and so on that IMI has created is amazing. It's amazing. And that interface needs to be structured and nurtured and helped along in terms of what we do. But that is I think that is going to be the secret of our success and absolutely necessary for certain things. US SMEs, I think this is also a comment, have 100 times more CBER, STTR grants, NIH budget in 1 year, 4 times bigger than H2020. Okay. Yeah, we know that if you compare US with the European Commission research budget, but that's not all that happens in Europe. Kurt, what are we? In the Commission research budget, it represents what, 10% of? 8% of the research and innovation budget in Europe through the member states, right? So people so often I hear, compare the US budget with the European Commission budget. It's not. Okay. Do we sufficiently prevent funding similar scientific initiatives in a topic and sufficiently capitalize on existing platforms and results each time? So that's an excellent question. So we'll integrate that question in last comments from the panel, and we'll start with Nathalie.
Thank you very much, Pierre. I can't answer that question. Sorry, the last one. I'm just going to say that up front. But what I did want to say are 2 things. The societal impact of IMI 1 and IMI 2, I think our 10-year anniversary next year is the ideal excuse, not only to have a party, but also to really make those extremely tangible and visible. Because what has always happened with framework program outcomes is that the people who do it are very aware, and the people who fund it are also very aware, but everybody else has little visibility. And I remember an event 2 or 3 years ago organized by DG Research in the square, where you could go to the booths where all the outcomes of FP6, I guess it was, were touchable and visible, and it was really exciting for me. It was really exciting. So I think we owe it to all of those who've been involved, who Kurt thanked, but also to society to explain this is where we've come this far. The second thing I wanted to say, and there are only 2, Kurt, you asked us to contribute in developing the next framework program, and you thanked everybody for having been here. And I hear SDGs, and I'm in this whole thing. I became a scientist because I want to help the world. So for me, SDGs that's fantastic. I mean, this is what excites me and makes me want to go to work in the morning. I think what's really important, though, is that everything we've learned in IMI 1 and IMI 2, all this increased flexibility, the way that we work together is not lost. So we will participate in trying to shape it. Let's not invent something completely different, because researchers are working on things. So if you suddenly, take things off under their feet, it's kind of hard to find. So I think the idea of us participating and collaborating in that genesis is super important. And I think I speak on behalf of all of us. We will participate. Let's just make sure that it has the biggest possible societal impact while maintaining the collaborations, that we don't lose our collaborations because they've taken so long to be created that it would be a shame to see them evaporating.
Thank you, Nathalie. Kurt, some final quick remarks?
Well, I think these are very wise comments of Nathalie, and as always, I agree with what Nathalie says. That's been the pattern over the last 20 years since we know each other. Now, what I really would like to say very quickly, when I hear that 60% of diagnosis is incorrect, then I wonder if I still should go and see a doctor. I'm getting a bit scared, but I read that artificial intelligence will actually improve diagnostic capabilities more than doctors can do. So that's maybe also something that IMI could look at, not as the core of your agenda, but I think IMI would need to be aware of artificial intelligence, data-driven science and technology, and what this means for your sector. And I think what the gentleman also rightly points to is what I also said before, the whole importance of skills innovation. We cannot lose sight of this, because there's a lot of technological and other progress coming, but if we don't have the people, or if I may say the workforce, to make it a reality, then it will not be taken up. Patience, I agree with that, of course. That's why we need a pedagogical exercise with finance and other ministers who really expect these investments in research and innovation to contribute to growth and jobs immediately. So we know that science and innovation need some patience. But the patience of society and finance ministers is running out. They want to see impact. So I think what we need to do, and that's also part of our thinking for FP9, is that we do not only have KPIs, key performance indicators, we maybe need to streamline what we have, but that we also come up with key impact indicators. So that we can say clearly, this is what we want to achieve by this moment in time. And then we need to be open to failure. We need to be tolerant for failure. But at least we say what impact we expect by when. That's the whole idea of the missions. It's nothing more than that. And that should also make it more possible to mobilize society at large in view of implementing some of these very important agendas that you have. On the duplication of topics, I think there open science, open access to publications, to data, etc. is really part of the answer. Linked with data analytic tools, etc. So that everyone has access to all the publications, all the results coming out, and to all data, except where there is a good reason not to make it accessible. And that's also the policy in the framework program now. It's open access to data by default, but if there is a reason not to give open access to data, then as a consortium we're really allowed not to give that access. I would like to finish off, Pierre, by saying that the work done in IMI is really very important, extremely valuable. We would like to see this continuing in the future in a more systemic, open innovation type of model, as we discussed. FP9 will not be a revolutionary new program. It will be a lot of continuity, but we need to do better on impact and on openness. On excellence, we're fine. But impact and openness, we need to do much better. But what I would really like to say is that I'm very honored and privileged to be here with you and to get these questions and comments. But please do not forget, the next 8 months, you have to talk to those who manage the purse. It is not good to talk to me or to talk to DG Research or to the Research Commissioner. It is those who decide on the money that will be crucial. So please tell your stories to the finance ministers, to economics ministers, to members of the European Parliament who will decide in fine where the money goes. Because I can tell you that the agriculture world, the regions, they make their voice heard. If we only hear from the scientists to DG Research, it won't do us any good. Tell these stories more broadly.
Thank you, Kurt. And the last word goes to Professor Gillespie.
I shall be short. So I started off preparing for this conversation with the mindset of 10 years ago, when we first put together the vision for IMI and created the case. And I ask myself now, after this conversation, have we moved on? And my answer is, oh yeah. Right? What we're talking about now, what we're able to do, what our political leaders are investing in, are listening to, it's almost unimaginable from 10 or 15 years ago. the amount of collaboration, the progress, the really sticky, difficult problems that we're addressing, hearing what Kurt's saying around system-wide integration and really looking at what does impact mean, how does society deliver it. Question earlier about can't we think of health as a security issue, as an economic issue? Well, we already do. We had many conversations with WHO, Jeff Sachs and others 10 years ago around neglected and emerging diseases of the poor being a threat not just to their economies and their people, but ours too. And we came together and began to address them in a way that we hadn't hitherto. So I don't think we should go away from this conversation to coffee and then later for a glass of wine with anything other than a spring in our step, actually, because collectively you guys and your colleagues have done great things over the last 9 years. And I think all of us are on a journey on, well, how can we do that even better? So, Pierre, your reflection in your first 2 years here should be one of huge pride, but also we will be checking that you're taking us forward.
Thank you. And we also have the luck and the honor to have the first executive director of IMI with us, Michel Goldman. So welcome, Michel. You're very welcome here. Okay, we're going to go for coffee and then maybe 20-minute coffee and then come back. And Hugh will be taking over the session then. Okay, thank you.